Children's hospitals are the country's or the county's largest employer. 60,000 employees and thousands more are patients and visitors. But tonight, an exclusive 5 on Your Side investigation uncovers a nationwide trend threatening even Cleveland's world-class hospitals.
On Your Side, Chief Investigator Ron Regan found violent attacks inside hospitals nationwide are increasing at an alarming rate.
Well, Cleveland hospitals are not unsafe, but they're now fighting the same crime trend that's threatening all kinds of public places, including violence. One violent attack just weeks ago.
Get out of the room!
A gunshot inside a hospital emergency room.
We need Garfield police up to Marymount Hospital right now.
It's after midnight, and a patient suddenly turns violent.
One of our patients just grabbed a taser, tried to get the officer, tried to grab his gun, and the officer just shot. We need police.
Grabbing an officer's taser, the patient is shot and wounded.
Did the patient get hit with the gunshot?
Yes, and he's still moving.
And it's not the first time Ohio hospitals have come under fire. Training videos show the danger. Gunshots have killed 4 people since 2010, a 5th wounded. Many more victims of assault.
Walked into his room, turned around, came out and slugged me in the face.
Sue Dailies is a nurse describing how she was assaulted.
He had kicked me in my back and my head with his steel-toed boots.
Boots worn by a patient here on the psychiatric wing at St. Vincent Charity Hospital.
It was very painful. I was off work for 7 weeks.
Dailies says while the hospital is now a leader in safety,
I don't think in the macro it has changed enough.
Just how much violence happens inside hospitals. This nationwide survey tells the story.
So the number one thing we found, violent crime.
Stephen Niblink is president of a leading foundation for hospital security.
We found that of the hospitals reporting in the survey, there was a 25% increase between 2012 and 2013. That's a substantial amount of crime.
It's 25 times more.
25 times more in a healthcare environment.
So we asked Cleveland hospitals for their numbers. At Metro Health, we found 110 assaults involving just staff members in the last 3 years, plus 273 disorderly conduct and domestic violence cases. At the Cleveland Clinic, 114 cases involving workplace and domestic violence or disputes. 46 robberies and assaults in the last 3 years. But university hospitals reported only violence recorded in the last 14 months. 2 assaults, 9 disorderly conduct cases. The hospital blamed record-keeping changes involving how violent crime was classified for the lack of data. But we found it's information hospitals have at their fingertips. So this is tracked.
Absolutely.
And they keep the numbers.
They keep the numbers. It's part of their security management plan. And not only do they track it and understand what's happening, but it's also a teachable moment for them.
No healthcare worker should ever expect to get hurt.
That was Dailies last summer, urging hospitals to improve safety. It was the first time a forum like this was ever held in Cleveland.
I heard from other people, even from management, you work in a psychiatric facility. What do you expect?
Across Ohio, in hospitals and healthcare settings, we found 520 cases of violent injuries over a 2-year period. 340 nurses victims of assault. And in hospitals nationwide, more than 22,000 violent injuries resulting in at least 21 deaths.
Oh, I think it's way underreported. Way underreported.
An Ohio Nurses Union says there's a reason.
Insubordination, or the facility saying that they're being insubordinate because they're not taking care of the patient at that time if a violent act happens against them.
The fear of being disciplined.
Correct.
And while violence is increasing, protecting hospital staff through videos and active shooter training is rare.
A generous number would be less than a third across the country.
Ty Motor is a hospital security consultant. His company creates videos like this for hospitals across the country.
Preventing an armed violent intruder is highly unlikely. However, through proper policy, training, and drills, we can dramatically reduce the overall effects of such an incident.
A message victims like Sue Daly says is still going unheard.
And I think that a lot of hospitals still have the attitude that it's just part of the job. You should expect that that may happen.
Well, the Cleveland Clinic reports it's seeing a decrease in violence at its main campus, both assaults and robberies over the last year. And the Ohio Hospital Association tells me it's working with hospitals across the state to keep them safe. I'm Chief Investigator Ron Regan.